Welcome back. Thanks so much for staying with us. Of course, we continue to get reaction that's in regards to our breaking news story. While the government is then expected to face numerous legal challenges after the National Health Insurance Bill was signed into law, some opposition parties and lobby groups have already indicated their intentions to approach the courts. Theuns du Buisson, economic researcher at the Solidarity Research Institute, joins us now. Theuns, thank you so much for your time. So the NHI is now signed into law, having heard what President Cyril Ramaphosa, as well as the Minister of Health's rationale just around the importance of providing adequate health care, for the entire population of the country and not just a system that benefits a few. The question then is, are you still against the NHI as Solidarity, and will you still be going the legal route to take government to court?
Yes, Unati, we are still very much against the NHI bill as it were. Well, we can call it the NHI law now. As it was proposed and as it was accepted today. We have already served papers on the presidency, the Minister of Health and Minister of Finance or the Treasury, and those papers include our intent to sue. Our complete court documents will be served on these same ministers and the president within the next week or so. So we are definitely still pursuing legal action because in our view this will not lead to better healthcare outcomes for everyone in South Africa, and it will corrupt the state, it will corrupt the taxpayer, South Africa simply cannot afford to implement such a system. We see even first world countries not being able to implement similar systems.
What about those that are saying, of course, that, it's a good way to equitize healthcare in the country, especially for the millions of South Africans who just can't afford, access to private healthcare? And I mean, we're seeing where the economy of this country is going. What solutions then would you provide in that sense?
Yeah, exactly. A good starting place would be, why are we in this economic mess where people can't afford private healthcare in the first place? And then that's one thing to address. Both the affordability of private healthcare is very far from perfect. So why are regulations keeping private medical schemes so expensive? Why are they being actively prevented by laws and regulations from offering affordable coverage to poor people? In our view, all working people at the very least should be able to afford a measure of private healthcare, and regulations have to change to allow that. But the NHI is not the way to do this because we simply cannot afford that. The second pillar on which this change has to come about would be to really fix public healthcare. We see, especially in the Western Cape, many public hospitals are running very efficiently, very well. So it can be done and it should be done. Government already has this responsibility and they have dismally failed at providing decent health coverage to all South Africans because theoretically, and in practice actually, all South Africans already have access to free and affordable healthcare in the public sector. And we, in our view, find it immensely irrational to expect the people who have destroyed public healthcare in the country to now take over all healthcare and expect better outcomes. It simply makes no sense. And I'm appalled by the president this afternoon, who it was clear he spoke as the president of the ANC and not as the president of South Africa. And it's clear from the Q&A session with the Minister of Health that nothing will change in the near future. So this is clearly an electioneering stunt by the governing party and nothing else.
Theuns, I just want to clarify very quickly. So as Solidarity, you do, though, agree that there is a need for universal healthcare, right? That seeks to somehow integrate the national healthcare system. That's not what you're opposing here, right?
We're definitely not opposing universal healthcare, but it's the vehicle that's being proposed here and that was just accepted into law that we have a massive problem with.
All right.
We, as a country, cannot afford it.
Okay, Theuns, thank you so much for your time.